Hi guys, my name is Angelica Maria Olson. I'm from Puerto Rico. Before yoga, I used to work for the U.S. Air Force. I got pregnant with my son, Emmett Olson. He's my first child. I was pregnant for 42 weeks. That's the equivalent of 10 months, 2 weeks. So I passed the due date I supposed to give birth. So I spent more time pregnant. So, um, as my baby did not want to leave, the doctors had to induce the pregnancy with an injection, and contractions were induced. And it was not like a normal delivery, it was more painful. So I had to resort to the epidural because I couldn't bear the pain. So after giving birth, my back was not the same, and I started to feel pain in my lower back. So I resorted to yoga to ease the pain. The epidural, when I get it, got placed here. They put an injection, and then you just have pain on your back. And after delivery, you just feel your body's not the same, and you know you're not the same person. So yoga can be a great way to build strength, improve posture, increase uh, energy levels, and reduce symptoms of postpartum depression, which is something that happen. It's very common because your hormones go high, and then you start feeling sad and you start crying for no reason. That happened to me. You also start fighting to your spouse, and it's because of the hormones. Adding certain postpartum yoga poses to your weekly routine also helps to the recovery process. When it comes to a weakened pelvic floor, tight hips, sore shoulders or neck, lack of endurance, and overstretched abdominal muscles. At first, you need to take it slow. So many moms want to rush back to drop the baby weight and hit the gym hardcore, but in reality, yoga is a much better way to initiate the healing process and understand your body and where it is. You have to refamiliarize yourself with your body. Remember, you just changed your entire body for nearly 1 year. So give it time before you try and bounce back. While it's best to check with your doctor before starting a gentle postnatal yoga routine, it is recommended to wait at least 6 weeks after childbirth unless you're doing specific pelvic floor exercises. And if you have had a cesarean section, the suggested time is 12 to 16 weeks postpartum. Because when you give birth, everything changes. Your body's coming back to normal. Because when you're pregnant, your organs move, everything gets wider, and then it needs to shrink the pelvic and everything there. So you just feel it. When I start doing exercise, I hear my bones popping up every time I move for no reason, and it's because everything is shrinking back. So you need to take it easy. um some of the benefits of postpartum yoga. So three keys of benefits of practicing postpartum yoga are rebuilding muscle tone, maintaining the integrity of your spine and pelvis, and preventing postpartum depression. During the prenatal period, your ligaments and joints loosen due to the relaxing hormone. These may remain loose and are prone to overstretching for several months after giving birth, but with yoga you can gently ease back as a low impact option. So, and finally, yoga promotes a positive outlook, gives you time to focus on your own well being, and decreases the risk of depression. From a physical standpoint, many new mothers find themselves hunched over frequently, which leads to pain in the hips and lower back. That's where yoga can release tension in the body, plus support better posture, flexibility, and core or pelvic floor strength, all without creating abdominal pressure. So I'm going to talk about some of the poses you need to skip. You cannot do it after birth, and then there's some poses that you can do and will help you to heal. So some of the one you cannot use for the most part, in order to prevent abdominal separation, known as diastasis recti, don't do crunches and deep twists during the postpartum period. You want to avoid exercises that build abdominal pressure or stretch your abdomen too much, like wheel pose or any intense backward bends. when you do yoga poses, make sure to hold your core muscles in tight and do not overextend your stomach. Avoid overstretching the abdomen as you're trying to strengthen it again. Here are a few specific yoga poses to skip, particularly if you're suffering from diastasis recti and or experience any kind of tearing during delivery. So those are cat pose, cow pose, plank pose, revolved triangle pose, malasana, and hanumanasana. There are 6 poses you can use. Those are the one I'm going to talk now. Those will help you. So the yoga posture I'm going to talk can help you improve your blood flow, strengthen your nervous system, and relax your body and mind. The ones I'm going to talk are the legs up in the wall. So that's when you put your legs up, you lay down on the floor, place your legs up, and then that one helps to bring the blood flow in the opposite direction, and it's a great pose to do before Savasana. And you can also do child pose, because this one focuses on alleviating the head, neck, and chest pain and opens the pelvic floor, hips, and low back. You can also do the mountain pose, the bridge pose, and the standing forward bend and cow face pose. I'm going to do a very quick example of the 2 of them so you guys can see it, and I hope this can help the mothers that have gave birth and want to heal their body on a less impact way. So mountain pose is when you place your hand, you place yourself in the mat and place your hand this way. Child pose, for example, it's when you place yourself like this, and then you just lay down with your hand palms up, and this one helps you to relax your body. When you do the legs up, this is a quick example. For example, the wall is here, you just lay down and put your legs up. And basically, those are the poses that you can do in yoga to help improve the process of postpartum healing. Thank you very much, guys. If you need a question, you can contact me and we can talk about how I can help you with the postpartum process. And thank you very much for being here. Bye.